So hello, my name is Shukuru Churi Henley. I'm gonna talk about, or I'm gonna present the project called the Electronic Health Record. So, as the introduction, I can start by introducing, of course, the project. So, electronic health record is a digital version in which the patient's health information is stored. Of course, the patient information have to be stored in order to be safe, in order to not meet with people who can use it in their own interest. And with this, even when this information can be used badly, it can affect the patient, which is very bad. So this information can include medical and treatment history of the patients. It also presents patients' diagnoses, medications, immunization dates, allergies, radiology images, and laboratory and test result. So all this information is very important since it helps to provide doctors, physician, and other person who are involved in the decision making of the patient health, of course. So electronic health record contain different information that concerned with the patient health, such as physicians, doctors, labs, specialists, imaging facilities. However, all practices do not yet arrive there. It means there are some practices or some hospitals that are, of course, lagging behind others. But also they are in the way of reaching there. So it is not every person who is allowed to reach the electronic health record of a given patient, because some of them can use them in the bad way, in the way that can negatively affect a patient, and a way a patient can even have interest. So the next point up beside the introduction, then I'm gonna describing the main component or the two components of electronic health records that support direct clinical care, and then I'll be explaining the benefit and the issues associated with the electronic health record. So the two electronic health record components that support, of course, clinical care are clinical documentation and radiology system components. And then allow me to go on with the first component, which is clinical documentation. So this clinical documentation increases the value of electronic health record by providing the electronic clinic note. Patient not only it doesn't only provide, of course, electronic clinic note, but also it provides patient assessments and clinical reports. Again, it enhances the buy-in program for the stakeholders to ensure the benefit of the clinic. As a matter of fact, 24%, or as a result, 24% of time of the nurse is saved, since many requirements can be found in the clinic, of course. So when the clinic documentation is complete, then it becomes easier for the healthcare providers, because this time they comes to make sure that every single health information of a given patient is recorded and is detailed, also it is accurate. Whenever they need it, then they will find it. This is why electronic health record reduces the ambiguity about the patient health information, because of course his accurate information is stored electronically. So on the other hand, when the clinical documentation is incomplete, of course they can lead to different challenges like higher readmission rate, long length of stay, failure in inappropriate post-discharge follow-up, and increase the cost and medication errors. So the automated clinical documentation can be the automated clinical documentation, physician, nurse, and the other clinic notes, flow sheets, transcription documents, transcription document management, and durable powers of attorneys for healthcare decisions. Then for the second component, I can talk about the pharmacy system component. This component consists of automating academic medical center and the large hospital and the large hospitals. So the robot can be used in this time, like to fill the payment, prescription, formularies that are not integrated with electronic health records. So this system enhances more efficient screening of drug charts and greater propensity in order to make good optimizing patient medication. With this, the patient are given the access to their own record in order to review their medication, laboratory result, and medical note concurrently. It means the patient in this case has to make sure that he has like the authorization of going on his electronic health record and read everything, revise, and know the laboratory result he got, like everything regarding his health as it is recorded. So from the above reason then, the pharmacist spent a lot of time reviewing the pharmacy system in order to facilitate the patient to access their medical note and laboratory result more frequently. It means sometimes there must be some challenges, and that's why pharmacists have to be there, like going deep in those records in order to facilitate the patient or anyone who want to go there, and the one who has like that authorization to access those records easily. So another thing is that there is a feature that is helpful to prioritize patient at each visit. This is known as pharmacy medicine management page. So since the patient access their own medical notes, they interact with fewer patients, yet conversation are more targeted. Again, pharmacy present of medical errors. This was reported by using the examples of how the paper drug chart show few errors by comparing to electronic pharmacy system. So then I'm gonna just on at the third point, then I'm going talking about like description of two components of electronic health record that support administrative processes, and then I'll be explaining like benefit and issues of those components. And then the two components are administrative system component and laboratory system component. Then I'm going to go through them. So starting with, allow me now to start with administrative system component. So this is very important. It is very important to know that electronic health record does not only register names, demographics, next of kin, employee information, chief complaint, patient disposal. No, it doesn't only, it is not limited on that. It also registers a unique patient identifier that doesn't allow the outside institution or organization to access. It means there are also other organizations maybe that may want to go there to check, like to look at the health record of the patient, but since you have this identifier, then those persons or those organizations cannot go there. It means the benefit of this is like to keep the privacy of the patient's record. So this identifier serves to the clinic observation, test procedures, complaints, evaluation, and diagnosis to the patient. Then allow me to go on the second like component, which is laboratory system entry. Laboratory is concerned with storing some administrative information like orders, results from laboratory instruments, schedules, billing, things like that. So the benefit of this information is that the analyzers and other machines use it to diagnose laboratory processes that are not easily integrated with the electronic health record. So allow me to go on the fourth point, which is going to be discussing the importance of the integration of administrative and clinical areas for effective use of an electronic health record. So there are like many importance of the integrated of administration and the clinical area for effective use of electronic health record. Some of them are the following. Then I'm going to illustrate some of them, not all of them, but some of them. So the first one is like providing the accurate health information of the patient, because the information are just stored right away. Then that's why the information are accurate. Electronic health record stores the accurate information of the patient because they get like information from different sources. Because if a patient comes in the given maybe practice or hospitals, he passes in the different way consultation elsewhere, and then they combine all those information. It means they get like a complete information of the patient. Another point is helping the patient to easily access their health information. The patient are given access to their health information so that they can review them when they need it. Here it is like better to clarify that a patient is not authorized to go through other patients' health record on his or her own health record. He has access on that, but not all of the health record of different patients. So another point is providing the safer and reliable prescription based on the since like there are different information of the patient from different sources, then it becomes easier to make like the right decision to the health of the patient, because they have like every possible solution or every possible information that can help them to, of course, to make like a good decision. Another point is like ensuring the privacy of the patient. Electronic health records present unique patient identifier that I'm coming to say there. So that like identifier, it keeps the privacy of the patient, because there is no organization or any other person or any other individual or an institution that may come and just frequent or go through the patient's like health record because of this like unique patient identifier. Thank you very much. This is the end of my presentation.